Hi guys. Okay, so today's topic is, so you take medication, huh? Well, yes, I do. I take a lot of medication. And it's absolutely necessary for me to take this medication in order to be a functioning human adult in today's society. I feel no shame about the fact that I take medication. It has saved me. I know what I'm like without medication, and it is scary. I have been a danger to myself unmedicated. My disorders run wild and put me at risk for my comorbid disorders to run wild. So for me to be unmedicated is unwise. So I'll go through and tell you a little bit about my journey through medication. I was first drawn into the world of pharmaceuticals at a young age whenever I developed migraines. I got them inexplicably. They became intolerable. They happened multiple times a month, and they were interfering with my education. So I was put on Topamax. And Topamax, along with my eating disorder at the time, really was like a good buddy-buddy pair because it helped suppress my appetite. And I kept that side effect to myself. I suffered through anxiety and depression and ADHD all the way through middle school and high school and college, but I went undiagnosed. It wasn't until I went inpatient for my eating disorder for the first time that I was probably, I guess I was around 21 years old, that I went through a lengthy series of tests. One was 3 hours long. The other one was an hour long. The other was probably around 20 minutes long. This battery of tests in order to diagnose me. Because I had already had my diagnosis of anorexia, purging subtype at that point, but they weren't sure like what else was wrong with me. So it was then that I was diagnosed finally with bipolar 2. I can't even list all of the medications I've been on for my bipolar 2. It's been many. I've tried so many to find the right regimen that it's daunting, and it can be a long, scary process to give up your autonomy over your body to these medications with the promise that they're going to help you feel better, when there's a very real possibility that these medications are actually going to make you feel worse. So currently I was going to show you the bag of medications that I'm on. To keep me sane. I take 4.5 milligrams of Vraylar. This is an antipsychotic. It helps with my bipolar 2. It acts as a mood stabilizer. I'm on 4.5 milligrams right now because I had been rapid cycling, and it helps kind of curb that and keep me more even. To pair that off, I am on Cymbalta. Cymbalta is also an SNRI. It works differently than an SSRI. I don't respond to SSRIs. Learned that the hard way by, guess what? Trying all SSRIs. Yeah, I went through and tried all SSRIs. You can look them all up. There's a long list of them. Tried them all. None of them, I wasn't responsive to any of them. So we switched to SNRIs, and I was on Effexor for a long time, and it worked until it just wasn't effective anymore. And that's when we tried Cymbalta, which is currently working for me. And I take 120 milligrams of that a day, which is a therapeutic dose. What else do I got in here? I'm back on Topamax, but it's not suppressing my appetite. I've been open with my doctor about that. My weight loss is actually kind of at a standstill, and I've been more gaining weight than anything in the current state of my eating disorder. So right now I'm on 100 milligrams of Topamax, and that's curbing my migraines. So yes. I'm on 50 milligrams of hydroxyzine. This helps me sleep. This is like a Benadryl on crack. And to go with that, I have trazodone. And I can take 1 to 3 tablets of trazodone, and they're each 100 milligrams each. So if I go to bed at like a decent time, I will take 3. If it's later on that I'm going to sleep, I'll just take 1 because I don't want to feel hungover. And then in the daytime meds, I have Xanax. And I can take 1 to 3 a day, 1 milligram each for anxiety. And this can be a lifesaver for me in times of emergencies when I'm having panic attacks. And I have panic attacks almost daily. And I can't explain to you how crippling that is and how embarrassing that is and how rough it is, but how thankful I am that I have medication that helps me manage it so I don't have to quit my job and that I can participate in life. And finally, I was, like a blessing, diagnosed with ADHD, and I'm on Adderall as well. I take 1 tablet in the morning and 1 at noon, and that is 20 milligrams each. And that helps me focus and complete tasks and plan and just function like a person, engage in conversations with people. It allows me to interact with my daughter. I'm able to do my chores. It's really like the glue that helps everything else with me. And there you have it. There's my bevy of medications that I take, and I just want people to know that there's no shame in taking medication. And for the people out there that give you hate and try to make you feel bad about taking medication, just like screw them. Like, you're doing what's best for your health, for your mental health, and like good for you.